viridans refers to 5 groups of streptococci that include Streptococcus aeruginosus group, mitis group, sanguinis group, salvarius group, and finally the mutans group. And each of these groups has approximately 30 species that can cause disease in humans. So the more correct term would be viridans streptococci, to reflect that there's more than one of them. Generally speaking, viridans streptococci can't be assigned to a Lancefield group based on their cell wall antigens. However, in the Streptococcus aeruginosus group, some species can be assigned to Lancefield groups A, C, F, or G. Now, viridans streptococci have a thick peptidoglycan cell wall, which takes in purple dye when they're gram-stained, so they're gram-positive bacteria. They're also catalase negative, which means they don't produce an enzyme called catalase. Okay, now, when cultivated on a medium called blood agar, viridans streptococci colonies cause alpha hemolysis, also called green hemolysis, because they produce hydrogen peroxide, which partially oxidizes initially red hemoglobin in the blood agar to green methemoglobin. One way to remember this is to think that viridans means green in Latin. Some species in the Streptococcus aeruginosus group, however, can also be beta hemolytic or non-hemolytic. These guys are special little snowflakes. Now, other Streptococcus species, like Streptococcus pneumoniae, are also alpha hemolytic. So an opticon test is done to distinguish them. That's where an opticon-containing paper disc is placed on a plate of blood agar that has been inoculated with the bacteria. With Strep pneumoniae, the growth of the bacteria is inhibited in the zone that surrounds the opticon disc, meaning that Strep pneumoniae is opticon sensitive. On the flip side, viridans streptococci are opticon resistant, meaning there's no inhibition of growth around the opticon disc. Another test that can be used to distinguish strep viridans from strep pneumoniae is the bile solubility test, which can be done in a test tube, or more commonly, by dripping drops of bile on bacterial colonies. Strep pneumoniae is bile soluble, meaning that the bile salts will promote the lysis of the bacteria, whereas viridans streptococci are bile insoluble or bile resistant. Finally, viridans streptococci also lack the polysaccharide-based capsule typical of Streptococcus pneumoniae. Viridans streptococci are commensal organisms that reside in the oropharynx, epithelial surfaces of the oral cavity, teeth, skin, gastrointestinal, and genitourinary tracts. So, they live alongside their host without causing harm unless there's a change in the environment. Inside the mouth, viridans streptococci, like Streptococcus mutans and Streptococcus mitis, adhere to tooth enamel with the help of dextrin polysaccharide, and aggregate, forming dental plaques, which can lead to dental caries and gum disease. In contrast, Streptococcus sanguinis promotes dental health by inhibiting the growth of Streptococcus mutans. However, when dental work is done, like a tooth extraction, viridans streptococci can enter the bloodstream and cause bacteremia. From there, they can make their way to the heart, where they may stick to a thrombus, an aggregate of platelets, red blood cells, and a mesh of cross-linked fibrin protein, on a damaged or prosthetic heart valve, and cause subacute valve endocarditis. This usually happens on the mitral valve. Here, the microorganisms form small vegetations composed of bacteria and a protective sheath of fibrin-plated aggregates, which can detach and travel to different parts of the body as aseptic emboli. In fact, viridans streptococci, especially Streptococcus sanguinis, are the most common cause of subacute bacterial endocarditis in both adults and children. Children with central venous catheters, or immunodeficient states, like neutropenia in the context of chemotherapy, are especially at risk. A particular complication in children is viridans group streptococcal shock syndrome, a toxic shock-like syndrome characterized by widespread systemic vasodilation, which leads to low blood pressure and poor perfusion of vital organs. Another viridans species, namely Streptococcus intermedius of the Streptococcus aeruginosus group, doesn't cause bacterial endocarditis. Instead, from the bloodstream, it lodges in other organs, like the brain and the liver, forming abscesses. In fact, Streptococcus intermedius is the species of viridans streptococci responsible for the most cases of brain abscesses. Now, symptoms vary depending on the infection. If the infection is in the mouth, symptoms may include bleeding or receding gums, bad breath, toothache, or tooth loss. With bacterial endocarditis, symptoms may include fever and a heart murmur upon auscultation. With toxic shock, there may be a fever, low blood pressure, and tachycardia. Brain abscesses associate neurological symptoms, like aphasia or the inability to use or understand words. With liver abscesses, there may be fever, chills, anorexia, malaise, and pain in the upper right quadrant. Diagnosis relies on cultures from biological samples, like abscesses, and blood cultures to identify viridans streptococci in the bloodstream. Alternatively, rapid antigen tests or antibody titers can be done. Additionally, an echocardiography can visualize heart valve vegetations. With a brain or liver abscess, imaging like computed tomography of the head and abdomen may show a mass. Treatment consists of the use of antibiotics like penicillin G. Other antibiotics with good activity include ampicillin, cephalosporins, vancomycin, and linezolid. Alright, as a quick recap, Streptococcus viridans is also known as viridans streptococci, since it encompasses multiple streptococcal species that usually do not possess Lancefield antigens. Now, viridans streptococci are gram-positive, catalase negative, alpha-hemolytic, opticon-resistant, and bile-insoluble. These are significant characteristics for diagnosis. The viridans streptococci reside in the oropharynx, gastrointestinal, and genitourinary tracts. They can cause wide-ranging conditions like dental plaques, dental caries, periodontal disease, brain and liver abscesses, and bacterial endocarditis. The mainstay treatment consists of the use of antibiotics.